Measles is a highly infectious viral disease. A person can get infected from the air droplets released through coughing and sneezing by an infected person. Within 14 days, an infected person would start to develop symptoms including rash and fever, among others. So, if you come into contact with an infected person and start showing symptoms, you need to get to your nearest healthcare facility to be checked.
As a department, we are managing. The outbreak has really commenced. Just a bit of context. South Africa has been having an outbreak of measles since 2022. There was a campaign conducted. Despite that, we continue to see the cases of measles. And this year, we saw in Gauteng almost 181 cases, but these are numbers that are obviously increasing.
There is no need to panic. However, parents and guardians are urged to take children to healthcare facilities to be vaccinated.
I don't think that we need to really press panic buttons, but I think responsible citizens, as what we are appealing, is that if you know that there is a campaign that is taking place, campaigns are nothing new, they happen from time to time, just make sure that children are taken to those facilities and they get vaccinated. But we are also conducting campaigns, and that is an effort to try and make sure that we contain what has been an outbreak that has been going on for some time.
The Tshwane region is currently the hotspot, with Johannesburg and Ekurhuleni also experiencing steady increases in infection cases.
Tshwane is the hotspot, and purely because there is an increase, especially from May to June, of cases, But we have been, like I've indicated, having sporadic cases that have been reported throughout the year. It's from January, So, but we have seen that even in Joburg, there has been increase in cases throughout January up to date. A bit of clusters of outbreaks here and there, but now Tshwane is the main, hot area where we have had cases in higher numbers in Mamelodi, to be specific.
The Gauteng Health Department says it has intensified its campaigns to manage the outbreak. The department says immunization coverage for the second dose of the measles vaccine remains below 75% in Johannesburg, significantly below the level required to prevent outbreaks. This has contributed to the steady increase in cases, including among people who had previously been vaccinated and some adults. Calvin Lula, SABC News, Johannesburg.